Hi there. In this video, I will share what diabetes burnout looks like, why it happens, and the 10 strategies I use when I experience diabetes fatigue and burnout. Make sure you watch to the end, where I share my bonus tip that I hope you don't find offensive. Trust me, this technique snaps me out of this unpleasant burnout state of mind pretty effectively. My name's Trevor, and I've been living with type 1 diabetes for over 42 years. I've raised 2 type 1 kids and worked in the field of diabetes education, and simply have a passion to share and help others along their diabetes journey. So let's dive in. As many as 1 in 5 people have diabetes distress or burnout at some point. Not surprising, as it's a 24/7, 365-day-a-year job that you can't take a break from. So what is diabetes fatigue or burnout? Well, it can be different for everyone, but can mean that you stop taking care of yourself and your diabetes. When I've been burnt out, it's like hitting a brick wall. It's like a heavy feeling, almost like a depression. And I've been there many times during my diabetes journey. I just don't care anymore what happens to my diabetes when I'm feeling like this. Diabetes self-care is all-encompassing. This condition, especially if you're highly motivated to have good control and good blood sugars, it takes everything out of you. How do I know I may be burnt out? Other than the feelings discussed already, or the feeling of hitting a brick wall and wanting to throw in the towel and give up the fight for decent blood sugar control, that's how I view it, here's a list of feelings and signs that you might be experiencing diabetes burnout. Strong negative feelings about diabetes, frustration, anger, and the feeling of being overwhelmed. How many times I felt that way in my life. Feeling diabetes has control over you, feeling powerless, feeling isolated or alone with diabetes, ignoring or trying to forget about the disease. I think they call that denial. Not checking or monitoring your blood sugar frequently enough or at all. Missing or skipping your medications or insulin, worsen complications, and overall blood sugar. Okay, now for the good stuff. Now let's dive into 10 strategies I use to pull myself out of diabetes burnout, or back into the fight. And stay tuned for the potentially blunt bonus tip at the end. First thing, accept your feelings. Be gentle and kind to yourself. I used to beat myself up with negative self-talk, and that never helped. Like, you shouldn't feel this way. You're a failure with your diabetes. So be kind to yourself, because these feelings are normal, and you are not alone. Others feel this way too with diabetes. Take small steps in regaining control of your burnout and diabetes. Don't decide one day just to do everything at once. It's not going to make you feel better, it's going to make you feel worse. Have little goals each day. Take a break, a safe one, like a night off your meal plan. Reduce your frequency of finger pokes. Hand over control of your CGM for a few days to a loved one, if you can. Or if not using a CGM, try to obtain one to give yourself a break from the continuous finger sticks and manual blood glucose checks. Sometimes data overload is the cause of stress. I find this in my case. So disconnect from your CGM or continuous glucose monitor, or your pump if you can, and you're safe, and you've had a discussion with your healthcare team, of course. I find that the constant feedback I get from my CGM can make me a bit neurotic, a bit loopy, leading to stress, over-treatment, under-treatment, overreacting, and it makes me feel worse about my diabetes. Remember, this is my journey and not medical advice. Get support. Reach out to others with diabetes, or loved ones. Local support groups, online communities, have helped me to not feel so alone in this very overwhelming journey as a diabetic. Connect with a mental health professional if you can. But just remember, you're never alone. There's always somebody feeling the way. Exercise. Get active, which is challenging when down and out or feeling completely burnt out. But exercise is Mother Nature's antidepressant and also great for blood sugar control. Get plenty of rest. Sleep is wonderful for stress. Aim for 7 to 9 hours per night. Dark room, no screen time. You get the picture. Stay off YouTube, unless you're watching my videos, of course. Limit your intake of substances such as alcohol, drugs, and caffeine, because they worsen mood, they make you more anxious, and it's just not a good thing. Take a break from things that cause you stress. That's not always possible, but it's okay to say no to someone you feel obligated to help out. It's okay to honor your own burnout and stress. Unless this boosts your mood, of course, then go help out that friend to make you happy. Eliminate processed foods and sugar from your diet. I take this one with a grain of salt. I can always make a case for allowing some in moderation to avoid the immense feeling of deprivation or self-denial that can come with having diabetes. It's so strict sometimes. Try relaxation techniques like yoga, meditation, being mindful during regular day-to-day activities, and when doing this meditation or being mindful, it's best to practice the attitude of gratitude, which I've talked about in previous videos. Having diabetes really does suck sometimes. Trust me, I know. But I can usually find many things in my life I'm grateful for, and this helps to reframe things. Now for the controversial bonus tip that I use. I set a timeline for feeling down and out, burnt out, especially from that poor state of mind Like, poor me, you know? I literally tell myself that I have 3 days or 1 week, depending on the burnout, and I set a time to feel this way. And then when that time's up, it's time for me to pull myself up and hit the reset button. It's surprising how effective it is resetting my attitude, just having that timeline to do it. Diabetes fatigue and burnout is a real thing. Recognize the signs we talked about and try to practice some of the strategies. Most important thing to remember is it's real. I would love to hear your experience with diabetes burnout and what you do to combat it. Please leave a comment and connect directly, and I will respond. Check out my early videos here, and here's to keeping those blood sugars home in the range. Bye for now.